Well, I was introduced to Dr. Schultz and to the ACMOS method and to BAH as soon as I moved here to New York to begin my medical practice working with Dr. Gurovich. And I was initially drawn to the BAH right away because I was trained as a naturopathic physician as well as a Chinese medicine physician, and one thing that I've noticed in the integrative medical model is that it's oftentimes very challenging to kind of piece together a lot of different disciplines. So there were many different threads, say the Chinese medicine philosophy and then the conventional scientific model of diagnosis and treatment, and seeing how that is laid out within the model of the BAH as a diagnostic tool really impressed me, because it's just been very, very challenging for many practitioners to attempt to combine all of these different disciplines in a way that kind of streamlines how to get to what's most important in terms of priority for diagnosing and treatment of the patients. You know, it's not really the business of the practitioner to decide what comes first for the patient or what really is the primary issue. It's that when the patient is sitting there in front of you, they're going to tell you what they need most. And I think that BAH offers a lot of these different modalities and certainly supplements and things like this using the acupuncture meridians, and then detoxification and drainage, all of these different types of methods of treatment, but really is able to streamline getting the information directly from the patient in terms of where to start. The biggest thing is that learning to use the Lecker instrument and really learning to kind of free yourself from the situation when you're sitting in front of the patient and kind of let your mind quiet down, and because we learn a lot of different traditions and we have a lot of information at our disposal, but I think it's a spiritual discipline in and of itself to get used to using the instrument properly and kind of letting go of reservations and kind of information that might be carried from the intellect and a lot of the knowledge that we bring to the table, and just really sitting in front of the patient and allowing that information to come. You're learning how to work with the process of transformation. So I think when you're working with the process of transformation with a patient and kind of sitting in front of them and allowing them to give you the information that you need to best support them, that internal transformation is also happening within yourself. As Dr. Schultz was mentioning earlier, oftentimes, you know, patients will come to visit you with information that you may need to hear, you know, on your own journey as far as healing is concerned. And so I think that really, in a sense, it's like a meditative practice to work with that. It's been a really phenomenal experience for me to see. As I was going through my process of learning and studying this medicine, there were a lot of areas that seemed really unrelated, that were just kind of personal interests that I had been looking into, that have been not only revisited through this, but very seamlessly integrated into the development of the BAH method. And so it seems like serendipity.